How well does anorexia nervosa fit with personal values? An exploratory study. Purpose. This study focuses on how do individuals suffering with an eating disorder, specifically anorexia nervosa or eating disorder not otherwise specified, anorexia nervosa type, experience their personal values. It focuses on their personal understanding of experiences or any aspects that may be valued within the eating disorder, their values that are not weight-related, and the conflicts that occur between and opposing values, between core values and their eating disorder. Study design. A qualitative method that involved in-depth, semi-structured interviews for this exploratory study. Interpretive phenomenological analysis, IPA, was used for the interviewing of the patients. IPA studies the experiences and perceptions of the participants. The main focus of the IPA approach is to avoid prior assumptions. This system was chosen to explore the perceptions of patients diagnosed with anorexia nervosa or eating disorder not otherwise specified, anorexia nervosa type, on the effects of personal values. Scientific question. How well does anorexia nervosa fit with personal values? Analyzing how personal beliefs and values clash with values of an eating disorder. Methodology. Recruitment. Initially, the goal was to recruit male or females who were currently being monitored for their eating disorders by a health professional. The participants were not engaged in or undergoing the first 4 to 6 weeks of psychological therapy. Participants in later stages of the therapy were originally excluded for fear of impact on their values. However, participants with any amount of therapy were then included within the study due to difficulty recruiting participants. Individuals who were eligible were invited to participate by clinicians within the two treatment centers. Written consent was given by all participants to be in a published study. Data description. 8 females, 0 males, ages ranging 20 to 40 years old, 7 white British women and 1 white Irish woman. BMIs ranged from 14.3 to 20. There were 2 inpatient participants and 6 outpatient. Inclusions and exclusions. Anorexia nervosa, or eating disorder not otherwise specified, anorexia nervosa type, and being treated at one of 2 London-based eating disorder services. Exclusions. Abuse of a substance that would meet addiction criteria, florid psychotic symptoms, organic psychosis, or a learning disability. Methodology and the answer to the methodology. There are 3 domains identified. 1. Balancing values. 2. Congruence and clashes between anorexia nervosa and values. 3. From ambivalence to motivation. This was reliable, but more of an analysis than concrete numerical data. It was a promotion towards recovery of anorexia nervosa. Balancing values. There were a large amount of difficulties with participants finding the ability to balance their personal values through being able to both relate and pursue those values. Participants revealed their values to be much more extreme compared to someone else's normal behaviors. No matter what they do, it was often described that the participants were never able to satisfy their individual goals. It was also found that the participants would risk their health to fulfill personal values or goals, such as losing sleep to complete projects. This domain also revealed the difficulty that 4 of the 8 participants had identifying their overall personal values and related this difficulty to their struggle with anorexia nervosa. This difficulty identifying personal values was directly related to the stage of treatment for the eating disorder the patients were in. The bigger the impact the eating disorder had on the participant's life, the more difficult it was to identify and differentiate their personal values. Congruence and clashes between anorexia nervosa and values. Participants reported some personal values were congruent to the behaviors and symptoms that corresponded with anorexia nervosa. The desire to be thin, physical, as well as restricting foods behaviorally, correlates with their core values such as having self-control, being disciplined, achieving their goals, working hard, and having willpower. A lot of participants view their eating disorder as commitment to their values and goals they set. Confirming to their values and eating disorder thoughts is uplifting to many of the participants. Participants also revealed that incongruence was most participants valued close relationships with their loved ones. But anorexia nervosa often interfered with this. It even secluded them away from social situations and having close relationships even more. Anorexia nervosa was reported to actually take over and control so much of the participants' life that the same control they craved was lost in other aspects. Participants spent so much time allowing anorexia nervosa to control many aspects of their lives that they lost control of all other parts. From ambivalence to motivation. It was indicated by many patients that through the exploration of their personal values, it was an eye-opener to see how much anorexia nervosa had taken over their life, and it became a motivator for them to take control back. It was allowed participants to discover that they found both fear and comfort within anorexia nervosa. Participants also reported that although they wanted to recover from anorexia nervosa, they wanted to hold on to certain aspects of it, such as having a positive body image when feeling they're thin. One participant mentioned the desire to be healthy and not risk, but also reported she wanted to stay the same weight while doing so. Last, participant actually found that by identifying her personal values as one motivation and an eye-opener, reality set into her near-death experience, and identifying personal values and motives allowed her to reevaluate and prioritize her reasons to fight against anorexia nervosa. Application to dietetic practice. This study provides a lot of insight to clinicians treating eating disorders. Identifying and pursuing personal values can be a viable route in treatment. This was one of the first studies to focus on values within eating disorders. It will provide clinicians a lot of great insight towards aiding their patients in identifying personal values. It uses motivational values as a way towards recovery. Current dietetic practice. Registered dietitians must have a good foundation of the psychological aspects of eating disorders. This article focuses more on psychological aspects, which would be more suitable for clinicians in this area of treatment. Dietitians are often the first to identify eating disorder tendencies. It is their job to apply the nutrition care process. By applying the nutrition care process, they identify the diagnoses of the participants and patients. Then they focus more on nutrition interventions for these diagnoses rather than the psychological aspects. Improvement. Overall, I think this study can provide a lot of insights to clinicians treating eating disorders. All of the participants were adults. Due to more knowledge and experiences, adults often have their values more organized and prioritized. It'd be interesting to see how adolescents who are striving to find themselves and discover their values would be able to differentiate. Lack of also could use improvement as all of the participants were female. Flaws. This study was only performed with participants from 2 treatment facilities. Length of study. It could provide many benefits to research from the beginning of a patient's treatment until the end to see how they are able to identify and comply with values throughout their treatment process. Conflicts of interest. This study was performed in only 2 treatment centers, which were both based out of London. It has questionable strength of treatment for these participants as they were all treated in the same 2 facilities. Would this study possibly promote the treatment within these facilities? How far along were the patients truly in treatment? Treatment teams may have questionable influences on both the participants and the study. Practitioners recommended their personal patients they found to be qualified for the study. It doesn't state what these qualifications are, and this could possibly lead to some biased decisions. Publishing. The participants were all at different points of their treatment. This is beneficial for the study. It allowed for an accurate representation of the population suffering from anorexia nervosa. The researchers were able to conclude positive values to patients with anorexia nervosa and being able to identify their personal values. The in-person interviews were performed, which provides a lot more insight as well as understanding to the participants' responses. Although there were many benefits, this study was still inconclusive in regards to the impact at which each stage towards recovery was of anorexia nervosa may have from differentiating personal versus anorexia nervosa values. Overall, it provided a lot of great insight towards self-motivation in treatment. It was was noted in the domain From Ambivalence to Motivation that because participants felt a lot of ambivalence towards anorexia nervosa and recovering, participants reported that ambivalence was due to the fear of not being successful rather than not desiring to recover. From the results, it is a suggestion from clinicians to refrain from using the term motivation as it may actually bring on a sense of failure or feeling hopeless, powerless to eating disorder patients. This could be used in all aspects of treatment. Sources.